My name's Finnin. I'm a physiotherapist and I'm the director of Physios Online. So we specialise in providing long-distance consultations to people who are injured and live or work in a remote location. So we're a currently operational, privately funded, publicly accessible service. I have 14 years experience as a physiotherapist, including a master's degree in musculoskeletal physiotherapy. That's quite a mouthful, 12 syllables. I've also lived and worked in some rural and remote areas, from country Victoria to the Northern Territory and Southeast Asia. I've authored booklets that remote health professionals use. But the recurring theme that I kept finding in all remote areas was a lack of access to quality injury management. Approximately 1 million people in Australia every year will find themselves in a remote location with a musculoskeletal injury. Now, traditionally, these people have had three main options available to them. One, they could travel long distances to seek healthcare, but we know that this is time-consuming and costly. Two, they could Google generic health information online, but this has been shown to be inaccurate and unsafe. Or three, they could just leave their injury, do nothing about it. But we know that this leads to greater recurrences and poorer outcomes. So I got a small team together and developed Physios Online. And so now, there's a better way. From the comfort of their home or workplace, injured individuals can get a tailored assessment by a qualified physiotherapist. This then leads to a clear diagnosis and a tailored rehabilitation plan. Now, I know what you're thinking. How can physiotherapy be performed online? It's traditionally thought of as a very hands-on profession. Well, physiotherapy as a whole is moving away from reliance on complex machines and manual techniques and more towards tailored rehabilitation plans which are carried out by the patient under guidance. So this converts surprisingly well to the online format, and there's extensive research evidence to support this. So the consultation process is simple. From the Physios Online homepage, health professionals can refer a patient by clicking on Refer a Patient. Patients can initiate the process themselves by clicking on Start a Consultation. They do not require a referral to use the service. From there, the patient has a choice between a written consult or a video consult. And this choice will depend on their personal preference, their bandwidth availability, the technology that they have available to them, and their comfort with the technical equipment. So, for a written consult, the patient will be led to complete an online form, which is tailored to their injury, and they'll then communicate with their physio via email, digital imaging, and web forms. For a video consult, the therapist and patient will work out a mutually agreeable time, and they'll have a video-to-video consultation. In both situations, once the assessment is complete, the patient will be issued with a report outlining their injury and its causes, and a rehabilitation plan that will follow through with them. And with our exciting new app, we can even send a tailored exercise program straight to a patient's smartphone if they have one. And this will include still images and videos of their exercises, along with appropriate dosage and timing information. So as part of the development of the service, a review was performed of all the relevant literature regarding physiotherapy teleconsultation. And it was found that there were a number of compelling strengths. Number one, diagnostic accuracy. The diagnostic accuracy was equivalent to on-site assessment. So there were no more errors in diagnosing online than there were in the face-to-face setting. Two, continuity of care. There was improved continuity of care compared with traditional remote health access. So the high turnover of health professionals synonymous with remote healthcare was avoided because the physios can work from wherever they like. Number three, internal locus of control. It was found that the patients that were managed online had an improved internal locus of control compared to those managed on-site. So the online patients were being taught to manage their own injury, so they had a lot more confidence in doing that. And number 4, the clinical outcomes. It was found that the clinical outcomes were on a par with those found on site. So it appears that the treatments were no less effective when guided online. So this is pretty exciting stuff, and it shows that physiotherapy teleconsultation is a viable alternative to in-rooms care. So Physios Online immediately addresses the national lack of access to quality injury management in rural and remote areas. But of course, it's not all beer and skittles, and there are some limitations to this format of healthcare. Number 1 is safety, and this is the most common question mark that people have. Physios Online ensures patient and therapist safety in a number of ways. All clinical records are password protected. We've had terms and conditions written up professionally on our website by an IP lawyer. We have a custom clause in our indemnity insurance covering us for online consultations. And all consultations and communications are recorded in full. So we have a 100% record of all warnings and advice given. And of course, we only use the best physiotherapists, Australian physiotherapists, who are qualified, registered and experienced. Limitation number 2. Some people can have difficulties with the technology use. So I think it's really important to tailor your consultation to what the person is comfortable with. Having said that, the research did show that although people may have had a high level of apprehension before doing the consultation, that dropped dramatically once they'd experienced the process. So it seems that if we can lead the horses to water, they're more than happy to drink. Limitation number 3. Some of the physical tests that physiotherapists use to assist with diagnosis clearly can't be performed without the hands-on. So we get creative, and I've been amazed at how much we can adapt these tests when required. A good example of this is a hip quadrant test, which is used to detect hip pathology or a hip contribution to a pain situation. Traditionally, a physio would lie the patient on their back on their treatment couch, take their hip up into full flexion and circle it into adduction. So in the online setting, we simply guide the patient to lie down on the floor on their back, hug their knee up to their chest, and then take it across to their opposite shoulder, with appropriate warnings, of course. We get them to compare that on both sides and report back to us regarding their pain and their range of movement. And limitation number 4. Not all conditions can be treated using this format of healthcare. But at least for patients in rural and remote areas, we know that we can refer them to an on-site service and that travel is then worth their while. In my experience, this has been less than 20% of cases. So there are limitations to this format of healthcare, but with some creative thinking, they are easy to get around. So early utilisation of the service has revealed a well-accepted and effective system. So research into usage, demographics and outcomes can now be commenced. So health consultations performed online are not yet considered mainstream practice, but we are reaching that tipping point. The Australian government's $37 billion investment into the National Broadband Network is a huge step in the right direction. And Physios Online are being used as a case study by the NBN to illustrate how it can improve access to healthcare for all Australians. I'm just so passionate about working at this intersection between healthcare and digital technology. And the rewards are clear when I can help an engineer in Mount Isa to complete his fun run after a calf injury, to help a lonely Australian girl teaching English in Japan to get the right diagnosis in English, and to help a new mum in the Northern Territory to get back into exercise after having her baby by helping to fix her knee pain. It's easier than you think to help people in rural and remote areas to feel connected, rehabilitated and empowered. Awareness of the existence of this service is now paramount to the uptake and fiscal viability of Physios Online. Private health insurance companies currently do not rebate for online consultations, and this simply must change if we're to have equality in healthcare access in rural and remote areas compared to their city counterparts. So today I have a twofold request. First, I'm looking for contacts within private health insurance companies or within other allied health fields that have a similar advocacy need. And second, I'm looking to spread the word. So if you could pass our website on to any other health professionals or organisations that you feel may be interested, it would be very much appreciated. So if you can help me with any of these things, I'd be more than happy to give you a free copy of one of my booklets as a thank you. So come up to me afterwards for a chat, contact me through the conference app, or email me, Karen@physiosonline.com. Thank you very much for your time.